People with organ failure waiting for a deceased donor organ transplant can choose to be added to a second waiting list, in addition to the standard waiting list. This second waiting list is for patients who have decided to accept organ transplants from donors who are at increased risk of having viral infections. These infections include the hepatitis B, hepatitis C, and human immunodeficiency (HIV) viruses. HIV is the virus that causes acquired immune deficiency syndrome, AIDS. Choosing to go onto this increased viral risk donor waiting list is entirely your personal decision. This decision will depend on the level of risk you are willing to accept. If you choose not to accept an organ transplant from these donors, your place on the standard waiting list and your care by the transplant team will not be affected. Even if you sign this consent form, you will still have the opportunity to decline an organ transplant from an increased viral risk donor at the time it is offered to you. Which donors are increased viral risk donors? Increased viral risk donors have had behaviors before their death which increase their risk of having hepatitis B, hepatitis C, or HIV infections. Some examples of these increased risk behaviors include injecting non-medical drugs and higher risk sexual behaviors.